Welcome in to Rick and Bubba University, the podcast. Bubba, today it's coronavirus, truth and lies. We're all in the middle of it, and we're gonna jump in right now and see if we can't just unpack it.
Well, Rick, we've heard a lot from politicians. We've heard a lot from the so-called specialists and scientists in the field who work in the governmental offices. We thought it would be a great take today to actually talk to a doctor who is practicing, who sees patients, and see what he thinks about all this.
And he graduated high school from the Stavanger American School in Norway, then on to Baylor University, which will make Stretch Armstrong very happy. He's a big Baylor guy, and he's here from Baylor. He went to the OU College of Medicine and did his residency in Tuscaloosa, the University of Alabama College of Community Health Sciences. His name, Dr. David Williams, and he joins us now. Doctor, welcome to Rick and Bubba University.
Thank you so much. Glad to be here.
Doctor, before we get started, I've got to ask, are you from Norway? Is that you went to high school there?
No, I'm originally from Northeast Oklahoma. My dad was with Phillips Petroleum, and we went overseas to England and Norway, and I graduated high school there. Then I came back to the States for college.
Okay, great.
How about that?
And you're well traveled. Then you've seen a lot of the world.
Yeah, and I've read a lot of your stuff. I know you're a big Auburn fan, and so.
No, my allegiance is definitely to Baylor, but my wife went to Alabama, and I told my kids their life would be a lot simpler in Tuscaloosa if they root for Alabama, so I gave them that option. So some of them have chosen Baylor, some of them have chosen Alabama.
Yeah. Now what, you don't have any Oklahoma fans in there?
Oklahoma is kind of a secondary school for me, but my undergrad is definitely my first love.
Okay. All right, well, we can't wait to get into it, but I want everybody to know right now, and Bubba, you and I have been talking about this Gabi insurance, and those that I'm wondering what I'm talking about, if you have car insurance or homeowners insurance, let's face it, it gets on automatic, and you just assume that you've got the coverage that you need, and you assume the amount of coverage that you need and you're comfortable with, that the price you have is as good as it can get. And the reason why we think that is I'm not going to take the time to look at 40 other insurance companies. I just don't have time for that unless I use Gabi, because here's what you do. When you use Gabi, they will take the pain out of shopping for insurance by giving you apples-to-apples comparison of your current coverage with 40 of the top insurance providers. Now, Progressive and Nationwide and Travelers, they're all there, and all the many others. Now, here's the good news. It takes about 2 minutes. Y'all, nothing could be simpler, okay? It's very, very simple. Even I can do it. It takes about 2 minutes. It's free to you. All you do is just link your current insurance. Go to Gabi, Gabi.com/Rick Bubba right now, and you go there. It takes about 2 minutes, and then you'll see quotes for the exact same coverage you currently have, and you'll find out if you're paying too much. How about this? Gabi customers save, on average, $825 a year, and if they can't find you savings like they did, for us, they'll let you know that you can now relax knowing you have the best rate out there. And they'll never, I know some of you are thinking about this, let me clarify this. They will never sell your information. So no annoying spam or robocalls, which also separates them from others that may try to do the same thing. Totally free to check your rate, no obligation, takes 2 minutes right now. See how much you can save on your car and homeowners insurance. Go to Gabi.com/Rick Bubba. That's GABI.com/Rick Bubba. That's Gabi.com/Rick Bubba. All right, so Dr. Williams, let's jump right in. Let's go with truth and let's go with fiction, because right now I don't think we know the difference. So let's start right now with one thing you talk about in the articles that you've written, and I've read both. If you have others, I haven't seen those yet, but I've read 2 of them. And one of them you said, none of us are trying to say that COVID-19 isn't a medical disease, and we're certainly not trying to say that it won't lead to tragic deaths, right? That's true.
Absolutely, and I appreciate you actually pointing that out. I do not do any programs where they don't let me acknowledge the fact that this is a legitimate disease and it will lead to deaths. And we would never minimize that. The people who have suffered those deaths and their families have our absolute sympathy. But what many of us have come up with is the idea that the tragedy that they're suffering, because it's being handled poorly, has led to way more tragedy and suffering for other people that is unnecessary.
So, but you do say, even though that is truth, it's also truth every year concerning many things that you see that lead to similar deaths.
Oh, absolutely. Yeah. We lose a fair number of people to respiratory diseases every year. And actually, what I did just like literally a couple of nights ago, you mentioned I've done two pieces. I've done multiple pieces that went directly to politicians. I finally went public because I got tired of the lack of response. And the last two pieces are public. But my next project, if I get it together, will probably be a video presentation. And one of the things I looked at is said, well, let's just look at whether we're truly losing more people because of COVID. And the CDC, they seem to be the biggest fans of COVID. They've made it to where you don't have to have COVID to die from COVID, which is an extremely strange circumstance. They themselves say that we're actually below regular pace for this year. So the people we're losing from respiratory illness are actually a little bit below pace of normal. And so we lose people every year to respiratory illnesses. It's something we cannot avoid. It's life on the planet.
Doctor, so let's start right there. We hear that if you die from, say, a heart ailment, but you also test positive for COVID-19, they ring it up as a COVID death, not a heart death. Or how can you speak to that? And is that the normal if you have influenza? The same thing with the flu? Or is there a medical reason for doing that, or is there a financial reason for doing that? Can you kind of clear, because we hear all kind of rumors.
Yeah. Well, what is absolutely not a rumor is that that states are testing, hospitals are testing for COVID for people that pass away from other things, including car accidents, which clearly the patient had no idea they had COVID, but if they link it to COVID, hospitals are being reimbursed at a higher rate. Now, I always kind of point out about the hospitals, I don't know what they're doing for that reason financially, but all the hospitals are basically suffering financially because of the handling of COVID, because their overall numbers are so down. They haven't allowed any sort of elective procedures for the last 5 or 6 weeks. So I'm actually an advocate for hospitals. It's in my first paper that says, look, our community hospitals are bleeding cash. And that one of the reasons we need to fix the approach to how we treat COVID is get people back in the hospitals that need to be treated for other reasons, for their benefit and for the hospital's benefit. But definitely April 2nd, the CDC changed the guidelines to where you could put any respiratory death as COVID, whether or not it tests positive for COVID, but they're also testing people for car accidents that have COVID and heart attacks that have COVID and linking those as well. So basically they're testing everybody, but even if they're negative, they can include the respiratory deaths. And I've included your references to where you can verify that for yourself.
Yeah, I want to think about that before you leave, because I want to be clear we understand that, because if that is the case, you said in one of your op-eds, and now you just clarified it, and I guess April 2nd is the place. You said you can trust numbers up to April 2nd, but after April 2nd, the numbers are up for debate because they changed the way they're doing it.
Yeah, the death numbers mean absolutely nothing after April the 2nd, because we've never handled any disease like this. And I put it out there on my piece. I said, if anyone has seen a disease handled for that like this, you please let me know. I've had the majority of doctors, and I'm gonna be honest with you, I don't know why they're not more vocal, but I'm pretty sure that the vast majority of doctors feel the way I feel, not the way that you're hearing from the mainstream media or the doctors who are on the mainstream media. However, they're obviously not given a mainstream media voice. That is very clear. But I've asked people who did speak out and said, hey, the majority were on the positive. I've had one or two that said, look, we're just not sure, just because you're not in a situation where you're seeing a lot of cases, that you really understand what's going on. Even those doctors, I went to them specifically and I said, now, before I put this out there, you tell me, is there another disease that's ever been handled this way? No, nobody's ever come up with a single one handled this way.
So, Doctor, we've also heard that there is a possibility of blood clots with this. Is it possible that COVID-19 is adding to heart attacks or other things? I mean, do we know for sure, or do we just don't know?
No, we absolutely don't know for sure. But we do know that viral illnesses as a whole lead to potentially other complications. Right. And sometimes they're a response of our own immune system. So, for instance, there's a disease called Kawasaki's disease, which you may have heard of, may have not. It is common enough that everybody in family practice residency and certainly pediatric residency will have seen it several times. But you probably haven't heard of it because there's fewer than 20,000 cases per year. So that's not something we advertise to the general public. However, the potential, which they haven't proven yet, Kawasaki's type illness with COVID has affected about 80-something kids, and you've heard about every one of them, right, which is another representation of the fact that this disease is presented very differently. Now, the blood clot, I'll be honest with you, it may or may not have to do with a inflammatory response, but I think it may have to do with the fact you put people in the house and they're not moving and they're not getting out. And so it's not particularly shocking you're seeing a rise in blood clots. That's what happens when you put people on a long plane ride, when you put people in front of TVs for hours. They're not moving those muscles, and they lead to more blood clots.
Dr. Williams, back to this April 2nd date and the way we changed the reporting. Why was it changed? Who dictated that, and why was it done?
Yeah, that I have no idea, but I feel like that's a very important piece of information to get. And I think the way we handle that is really important as well. I've had several people, of course, once even before I put my website address or my email address on there, people who found me. And one of them in particular was asking questions about, well, who do I trust? If I can't trust the World Health Organization, which I told them, I said, listen, you didn't lose anything there. The World Health Organization has not been a valid source of information for quite a while. They're very politically driven, and Trump did the right thing in cutting the funding there. But the CDC, man, we need that information to be accurate. So whoever changed that and is making it to where that information is not something we rely on, we've got to get to the bottom of that. And I don't care if it's a politician, I don't care if it's somebody within the CDC, but that handling needs to be explained.
Dr. Williams, it seems like the handling of this, as you point out, has evolved. And I understand to begin with, we had estimates of 2 million people going to die. We thought we had the Black Plague, the Spanish flu, it was a 100-year pandemic. It was time for it to come through again. And we did all these things because we didn't know. And I don't even blame some of the politicians because nobody knew. But week after week, our numbers have got more clear. And now we know a lot more of what we're dealing with. How would you surmise that versus the flu that we have every year?
Yeah. Well, in all honesty, I do understand how many people would think, look, we didn't know, so we were very cautious. However, my first letters to senators went out March the 20th. And on March the 12th, I actually told my wife I would bet every penny we have, including what I can find on the couches, that I know this thing will not kill as many people as the flu if it's handled correctly. Now, at the time, I didn't know they were going to make up death numbers later. But from January 1st to April the 1st, the flu was killing more than 2.5 times as many people as COVID. And I knew that based on two things. Number one, it started in a city of 11 million people in a country of 1.4 billion, and it killed less than 4,000 people. Whereas the flu kills 38,000 on average here. As recently as 1718, it killed 61,000 people in a country of 340 million. So then it goes to Italy, and everybody freaked out about Italy, but it's killed about 24,000 in Italy. The flu killed 24,000 in Italy a couple different times between 14 and 16. And then in 17, 18, it killed more than that because they've got a lot of different issues with their health system. Their socialized medicine, they got 60 million people in a very small landmass. They've got an old population. And frankly, they get overwhelmed by almost every respiratory illness. It's just you don't see it on the news every day. So I'm frankly was arguing from the very beginning not to shut down. I didn't see a reason to shut down a country for this, but I could see where some people who didn't necessarily have that knowledge would say, okay, let's be real cautious. But I agree with you. The information becomes more and more clear all the time, and yet we refuse to fully act on it. I know we've opened up some, but I mean, they're talking about like we can't have football, but I promise you 98,000 healthy people can be together without a significant threat of COVID.
So, Doctor, let me surmise what you're telling us to be sure I understand it, and everybody who's listening to this podcast. Are you telling me that based on the facts that you've seen and that you know, that the COVID virus is really just another flu, and we're getting the same results as just another flu, other than it's being politicized? Or is it worse, or is it not as dangerous?
Yeah. Well, and one of the things that I want to point out is I will be happy to give you my summation. But one of the things you hopefully noticed in the introduction to the second article is, look, I am no longer trying to take, I am the expert on this disease. I never wanted to say that. All I wanted to say is we are not looking at the facts accurately. And I want to give you those facts and let you make your own opinion. So when I give you the information, I absolutely want patients to look it up. I want them to say, hey, we're going to see if this guy knows what he's talking about, but we're sure going to start thinking it through and make our own decision. But now that you've asked for my opinion, yes, from January 1st to April 1st, the flu killed more than 2.5 times as many people with the exact same shelter in place, with the exact same travel restrictions, and with a vaccine, which we obviously don't have for COVID. But the other thing is, and I think everybody knows this, if you've got children, when they go to school and the flu gets started in a school, I mean, you're talking, very quickly, classes have multiple members. I've seen as many as 23 members in a single 25 classroom that are sick from the flu. You do not see that with COVID. And when you do have the flu, you know you have the flu. And one of the things I pointed out in one of my articles is, Michael Jordan played the most famous flu game of all time. Almost none of the NBA players even knew they had COVID. So I think the flu, personally, is something I would fear more as a whole.
Yeah, you said this, and one of the things that jumped out of the article, you went as far as to say, in my expert opinion, based on actually seeing patients, unlike Dr. Fauci, and you don't have to throw Dr. Fauci anywhere. It's just a fact he hasn't seen patients in 20 years. That is a fact.
That's fact.
And you see patients every year, multiple times through multiple flu seasons. Is that accurate? That's accurate. And you said,
I want to interrupt you real quick. I don't necessarily treat a lot of infected patients anymore because I do preventative medicine, but I've seen as many as 62 flu patients in a single day, and for 15 years I saw infected patients every day.
All right. Yes. With that being said, you said based on your experiences, okay, you went as far as to say, and you're kind of touching on it now, but I want to clarify, like Bubba did a minute ago on the other point, you think that COVID-19 isn't more infectious than the normal influenza, based on some things you just said. And that's all we're hearing. It's more contagious. It's more. I've even said it because I've been told that so many times. It's highly contagious, more contagious. You say not any more contagious than what you've been seeing with the others.
Oh, no, I don't think it's anywhere close as contagious from the experience that I've had. And plus, I'm going to go to a couple things in the article real quick because these are things that everybody can see. But you guys do have children, right?
Yes.
You both have children?
Yes.
You've seen the flu in daycares and schools, right?
Yes.
I mean, did not multiple kids in the class get sick every time?
Yes.
All right, so that happens with the flu. We've all seen this. The flu is highly infectious. You really can't run a daycare during flu season once it gets started because kids under 5, they just can't keep their hands out of their mouths and whatever. They literally have to shut those down every single year. And I'm sure they did in the county you're in. They definitely did in Jefferson County. They definitely did in Tuscaloosa County this year. I know they did. I've already verified that. So given that, we know how infectious the flu is. But locally, there was recently a poker tournament, and to follow the rules, they kept the 4 different locations, and they would rotate the tables around. They'd have 8 different people. They had dealers, and it turns out that one guy had COVID. All right. Now, he didn't know he had COVID because he had no symptoms whatsoever. Again, very different from the flu. But he came into contact with 35 people. All 35 were tested negative. Not a single person contracted it. I know of another company where somebody came back from their honeymoon in February. So this is before all restrictions. She came back to work. She suffered a flu-like illness. So she actually did have symptoms, but they tested all 39 other people in the office. Nobody else contracted it. So these are cases where I'm seeing, right here where it doesn't seem to be as contagious. But then you go back to the NBA, which everybody knows about, because Lord knows they told us about it hundreds of times, and they tested hundreds of people, and only 14 were infected. Only 12 of them didn't know they had it. So only 2 out of hundreds even had symptoms at all. Then you got the aircraft carrier, and again, you probably have been on a military ship, or at least seen one.
Yeah.
That's the tightest quarters I can possibly imagine. You've got 4,800 people, and you've got 600 cases going around that carrier, and yet 4,140 never got it. 400 never knew they had it. So you're talking about 95% of the people either didn't get it or never knew they had it in the first place, and the majority of the rest of them had a cold.
So who do you blame for the misconception out there? Is it elected officials? Is it the media? Is it social media where everybody can get on there and type behind a keypad and it go all over the world. How has it got so blown out of proportion, do you think?
By the way, all the above, I guess, is an answer as well.
Yeah.
Yeah, and all of the above is the correct answer. I mean, every single one of those has a contribution. But if you did not have a media that talked about it 24/7, they couldn't possibly keep this thing going like they have. So if I had to pick the most prominent, it would probably be the media. Again, I find it absolutely baffling that there's anybody in this country that doesn't think this is the weirdest coverage we've ever seen in our life. I mean, we've just never seen a story that stayed on there for 100 days, had constant meters going. And frankly, I mean, I know the numbers are big, but epidemiologically, they're not big at all. I mean, is a billion bigger or is 5 million bigger? Well, a billion's a whole lot bigger. Well, that's how many global cases of flu, but they've never told you about any of them. So it's really, really odd.
Well, and you mentioned that about the normal flus. I've coached teams, getting into the sports now. You mentioned the NBA. A kid on the team gets the flu. Guess what we say? Hey, man, we're going to have multiple people with it. And we do. And you try to get it stopped, and you send the people home who are sick. Some teams will have so many people sick, they can't even play the next game.
Right.
But we don't shut the whole sports community down.
We do not. No. We've never shut down anything for a disease before until this one. Now, if you had a legit Spanish flu, you might make that argument for at least a little while. The Spanish flu, back then, the entire population of the world was 1.5 billion. And it infected a third of them, 500 million people out of 1.5 billion. So in today's world, you would be talking about almost 3 billion people, 2.3 billion people would be infected, and 10% of all of them are dying, including 20-year-olds. That'd be a whole different story. But we're about 71.5 million away from even getting to 1% of the population infected. And the vast majority of the 5 million cases or so that we're heading towards now, mild, so it just doesn't make any sense from that standpoint.
Dr. Williams, let's talk about the virus itself. The fact that it has spread like it has, is that just what RNA viruses do, or is this one different? Is it a leap forward? Is that why people are having trouble with it immunity-wise, or is all of this just misconception?
Well, again, when you're looking at confining it to a carrier and 86% plus don't get it, it seems to me like immunity-wise, the average person with a healthy immune system handling it very, very well. Without question, and I've actually reached out to areas that have had bigger cases. I had dinner very recently with the anesthesiologist who's probably intubated more patients in Tuscaloosa County than anybody else with COVID. And I've talked to people who are actually treating, quote unquote, the front lines. And when it does overwhelm an immune system, it is scary. And the respiratory distress is very, very rapid. And there's no question that that's a tragic circumstance. But almost all of those cases are multifactorial, either obesity and diabetes, heart disease, hypertension and diabetes. A lot of the patients in New York were especially vulnerable. And certainly, these are still human beings, but say the homeless that have a lot of things working against them, and stay in very tight conditions where they're literally laying right next to each other, things like that. So there's reasons that it's spread among certain populations, and if it gets started in a nursing home, we're going to lose several people. So it is important to do things to protect the vulnerable populations. But I think the healthy immune system seems to be handling it quite well from every piece of evidence we've been given.
Dr. Williams, there was a study that came out that said that when we put someone on a ventilator for this, 90% of them did not recover. We asked one of the doctors at UAB. She was saying, well, they misfigured that. And if you really do the real numbers, it's more like 20%, which is probably kind of what that number would be with anybody on a ventilator. Do you have any information on that? Is the ventilator the way to go on this, or is that not the way to go?
I've been asked that question before, and I'm real careful to tell you what I feel comfortable I know, and then I just don't comment on things I don't know. I'm not in that arena right now. I do know this: if somebody came in my ER and they couldn't breathe, back in the days I was intubating people, yeah, you're not going to let them suffocate in front of you. You're going to do what you have to do. So I don't know. I do think that as many times as I've started to hear that, that those doctors need to continue to speak out and speak about better therapies. I've also heard from a few respiratory therapists that they think some of the way they're managing the vents is making a difference. So I think that information will evolve. But of all the things we've talked about, there's almost no way to fault that original approach. I mean, we just didn't know a different way to handle it. So I think that will evolve. But that's another thing that I think as a whole would be a medical community thing, not a public discussion thing for any other illness.
Doctor, let me ask you this too. I have spoken indirectly with two people who went to New York to help with this pandemic. And they were treating the COVID patients at the hospitals. I mean, they were downtown, right where the rubber hits the road. Right. Both of them came back with similar reports that a lot of the things they were doing was wrong, and that both of these people had been on mission trips to third world countries. They compared it to that and said a lot of the people didn't know what they were doing and conditions were horrible. Have you heard any of that?
Yeah. Again, I did reach out to some people who had some experience in New York, and I don't know what all's happened in New York, but I do have some questions about some of the ways they've handled it. I have a lot of questions about some of the numbers they've given us. Frankly, I trust some of those videos, which I have a link to, where either a guy is telling the truth or he's got a budget, where he can recreate New York City, showing no lines where they're claiming there's a lot of lines. So I think New York is a really tough place to get good information from. But the people that I did talk to, they said it was almost, number one, it was not the numbers you were being told. All of them were sent home early. None of them stayed, the entire course of what they were supposed to stay because they were not needed beyond a certain point. And then they were always the most vulnerable that were actually suffering the disease. There are definitely people there that have suffered, but it's a strange situation, and I don't think we can get a good story.
So let's talk a little bit about what our country has done. Local, state. We found out in our state, which is a state where you practice now, we did not have one death that was below 50 years of age, and 95% of those had all the health conditions pre-existing you talked about, and the average age of death was 72. So when you think about that, that would be very similar to every single year that we have influenza, correct?
That's correct. And like I said, I actually, it was literally, I think it was Monday night. I said, let me go look and see, what are our numbers, 2020, are they significantly higher? And they're actually a little bit below pace. Yeah. So we're losing the same people we would lose for any other condition, except what we've chosen to do this time is put 30 million people out of work.
Well, then that leads to my next question.
Another problem.
The current policies instituted by the local, state, and national governments, you say, are causing greater health problems than the virus ever will.
Oh, yeah.
Unpack that for us.
Oh, yeah. I mean, when you think about, I'm going to give you like a little anecdotal story, and then I'll go into things that are not anecdotal. But I know of a 70-year-old gentleman who has known heart disease, and he just wouldn't go to the hospital for fear. Now, I was involved in his case. I didn't have a chance to encourage him to go to the hospital, but I heard about it later. Wouldn't go to the hospital for fear of COVID. Well, when he got there, he had ischemia. He had suffered probably a greater infarct than he needed to suffer. And it turns out he had COVID, and he never knew it. 70 years old, not a cough, not a fever, not anything. So unless you're going to blame his heart disease, which apparently you're allowed to, according to the CDC, on his COVID, which he had heart disease before he ever had COVID, he had no symptoms whatsoever. But his heart disease is now further along. His damage to his heart is further along than I think it needed to be had he gone to the hospital 2 weeks ago. Now, I know for a fact, and I mentioned this in the articles, that there are people who've had palpable masses, breast masses that have not been able to have any quote unquote elective biopsy, an elective procedure to remove those masses. I know there are people who have known colon cancer who've had their colonoscopies delayed. One of those in particular, I followed up with just to see kind of where they were. A colonoscopy that was supposed to take place in April will now take place in August. So if he's developing a mass, that's going to put him at greater risk. And I can't tell you how many social workers have reached out to me and said, we thank you for what you're doing, and especially the fact that you point out that there's a psychological impact of what we're doing. We are getting more calls on child abuse. We are getting more calls on domestic abuse, and that needs to be brought out to the attention. So, depression rates are up, suicide hotlines are up. We just can't put people out of work and take them out of their life and keep them confined and expect that there's no consequences.
Well, and I would add, if you want to add in an article coming up, I'm now getting this from people I know that work on the front lines. Now the new thing is we release people from jail. Well,
Yes.
It's one thing to release somebody who's waiting on trial. I don't have a problem with that because they haven't had their due process. But releasing people who were convicted, and I talked to an inner city ministry that said we're seeing the negative results because we're not allowed to now go meet with the people we were helping. The people who have drug problems can't get to their groups that are helping them. They won't let them meet. And then said we had a woman who had an abusive boyfriend who got put in jail. We got her in a safe house. We were treating her. She was doing great. And then the county or wherever, something here in our state, let him out of jail for fear of COVID. He came back and has beaten her, and now and he's taken her back. And they said in some of our bigger cities, I forget which one it was, where they said they released these prisoners, and over 100 of them have already been arrested again because they're back committing crimes again. And here's another thing that would not have happened if we had just treated it like a normal flu season.
I do find it troubling that people aren't willing to kind of think things through. And frankly, troubling that, just bottom line is we've elected a lot of the wrong people. They're either incompetent or they're crooked. Either way, it doesn't matter to me anymore what their issue is, but they clearly are not thinking in the interest of their constituents, because they are putting them at risk for all kinds of things. And the fact that we're just like, the only thing we think about is COVID, that's all. And we don't think about any other possible consequence. We don't think it through. We don't think, what does it really mean to put people in an abusive situation and leave them there? My business is based on accountability. I do wellness medicine, and I do not charge for follow-up visits because I let people away every week for free because I insist on it. Because I'm like, look, you can't do this by yourself. And yet we've taken people who can't do drug rehab by themselves, and we've said you got to. And they can't. They're just not capable of doing that. But you're absolutely right about everything you said, and the fact that these things haven't been thought through are pretty tragic. And one of the things that I mentioned in my article, I'm sure you noticed, it was about the people who are dying alone in nursing homes. And if you extend that to the fact that people can't visit, now you've got an elderly person who has an accident or a medical condition, they get put in a hospital. Well, they only are allowed one visitor. And if that's an elderly spouse, what that usually means is the family gets no information because the elderly spouse can't communicate that information. So you got two choices. You send somebody younger, and they don't get to see their spouse, which is very not good for an elderly person. They do very well with the people they've been with for 30 and 40 years, or you get no information. And I just hate that we've gotten that situation.
By the way, I just wanted to point out for the discussion, life expectancy in our state now for a male is 72.6 years, for a female, 78.1. Right. Doctor, let me ask you, this is coronavirus is an RNA virus, right? Is that correct?
Yeah, I believe so.
We've heard a lot about vaccines. Well, if we get a vaccine, is it likely we're going to get one that works? And if so, how have we been able to get one for this when we really don't even have one for the common flu? I mean, we have a flu shot, but we don't have a vaccine for it. We don't have one for HIV, and there's a lot of other ones that I can say, and there's been a lot of research went into HIV and a lot of money.
Yeah. We actually do a pretty good job with the influenza vaccine. And I will point out that, everybody knows about the flu, and you know that you can get it at any age. As a matter of fact, it has killed roughly 150 children this year. So the flu will kill all the way down to kids. And yet probably the rate of vaccination is probably about 50%. So part of the problem with the flu is not necessarily we don't have a vaccine. It's just a lot of people don't get it. Obviously, some years it's more effective than others, but you're always having to speculate. The flu is kind of like a slot machine. It's coming up with a new antigen every year, and if we nail it pretty well, then it works really well. And if we don't nail it very well, and it comes up with a different combination, the flu seasons tend to be worse. But we haven't done a lot of coronavirus vaccines in the past because they haven't been as transmissible among humans, and so we've never developed one that we actually used. I don't know how successful they'll be with this one, but I go back to the fact that you can confine it on an aircraft carrier and 86+% aren't even going to get it. I don't think I'd be vaccinated for that. So if you want to come up with a vaccine, sort of like we have a pneumonia vaccine that we use, the pneumococcal vaccine we use in the elderly, and you want to target it to the vulnerable population, I think there'd be a use there. But I don't really see a point in doing a general vaccine for this.
Yeah, and you know, my parents do the pneumonia vaccine because they're 79 years old, and but you go back to what you're talking about this is some unknown thing. You made the point that this was not as unknown as we're being led to believe, that we do know a lot about coronaviruses, and because we were led to believe this just came out of nowhere, it dropped down on us like an unknown monster, and really, if you look back, Dr. Williams, Fauci didn't seem overly concerned. Cuomo, of course, he's the politician. I'm just using now doctor, now politician. They weren't overly concerned. And we went from nobody is overly concerned.
De Blasio wasn't. He was telling people to go out and eat like normal.
We can do this. We can do this. It's just another flu. It's not even as bad as the ones we've already dealt with. You know, you go back to the inconvenient, very good numbers from H1N1 that people seem to be ignoring like it didn't happen. And then all of a sudden, out of nowhere, it was the end of time. I don't. We can't follow that. I'm not asking you to come up with a question because I'm assuming the questions you're asking, you don't follow it either.
No. You basically surmise, part of my frustration. I tried to describe, especially in the second piece, the fact that none of the way this is handled has made any sense. The fact that Fauci's been all over the place. I used the football illustrations. Said we're going to win easily, and then we're going to lose by 3 touchdowns. As far as the immune system, it doesn't make any sense whatsoever. The only thing that's the common variable that has not changed is that the media has said it's the end of the time, and they keep saying it. And no matter how much evidence that we give them that it's not, we can't get them to back off that narrative. And unfortunately, you've got too many people who haven't done their own research and fall into that narrative. And so therefore, the politicians react that way. For certain politicians, it's led to an opportunity to ask for a whole lot of money. It's led to what were terrible approval ratings to be improved approval ratings. So, I'm pretty disappointed with politicians, but I think you can probably get that from my pieces.
Doctor, let me ask you this, back to vaccines in general for health. We've obviously had some real wins, polio, smallpox, a couple of those things come to mind. Are we getting out of control with vaccines? Are there too many of them, or do you like the vaccine? Do you think we should keep coming up? Because I know just from having kids at different times, it seems like the later you have a child, the more things are quote unquote required or on the schedule to have. Is that, talk to us about vaccinations in general, far as building up immunity to things?
Yeah, and that's of course what you're trying to do. You're trying to expose the body to either a weakened version of a future opponent, or you're trying to expose it to a dead version of an opponent, and then make your body say, okay, I've seen this before, I'm going to ramp up my defenses, and then I'll be ready for it. And once you've kind of trained your body to do that, if you get exposed to it, you ramp up those defenses much, much quicker, and you create the antibodies you need to. To this point, I felt like we're in a pretty good place. You definitely want, vaccines for things like, measles and mumps and rubella, and you want those. But keep in mind, these legitimate killers, I call them legitimate killers, when they would get started, when smallpox got started on a ship in the 1700s, I mean, that ship came in with a lot of dead people. I mean, it wasn't like, 4,800 people and, And admittedly, there was one fatality on that carrier, and that is tragic. I know nothing about their health history, but it wasn't one out of 4,800. I mean, it was, ships had several hundred crewmen, and they would lose, a couple dozen at a minimum. So the legitimate killers, we can't ignore them, and we have to vaccinate for them. Of course, we've eliminated most of them because, we've vaccinated for long enough. But I think, influenza's a worthy opponent. But frankly, I don't think COVID is sufficient to create a general vaccine. It would have to be a specialized vaccine for me, nursing homes and the elderly, that sort of thing.
Let me ask you this, Doctor. You did it in passing. I'm looking. We only got about 5 more minutes, and I want to be sure you clarify this because this appears to be the latest scare. Okay, people are trying to go back to their normal lives. They're reading the numbers. They're researching themselves. We have medical doctors like you that are coming out saying, look, I just have to speak the truth here. So now they want to scare us with, it's coming after children. And you're saying, yes, there is something that's affecting children. Will you please explain?
Is it connected?
What this is? Because you said we do have this, and you did mention that influenza, this year has already killed 150 children. But so tell us about, because this is the latest thing. Everybody seems like they're not getting afraid of it enough. So now let's come up with children when we thought they were safe. No, they're not. Tell us what's going on with this latest thing.
Yeah, actually, the irony is, I got almost all of my numbers from articles that were designed to scare people. Right? Like the article about the Theodore Roosevelt, which is the aircraft carrier. The impetus of the article, the bent of the article was it's a stealth weapon. Most people didn't even know they had it. That to me isn't a stealth weapon. It means it's not bad enough to get you sick. But the point is, most of the articles, including the stats I've gotten, have come from media members who are absolutely trying to point out the dangers of COVID. And so there's several of them have pointed out, hey, our kids are not completely safe. We haven't seen any deaths under 18. We haven't seen, but don't worry, they can get sick too. So don't be relaxing. And now you're hearing about, every single case of a possible inflammatory response to the virus. But the truth is, it hasn't been proven. We don't know for sure if it's from COVID or something else, but we do know we have inflammatory responses. Like I said, around 20,000 a year in children. It almost invariably affects their heart, which, this seems to be, and that would be something like Kawasaki's disease. So I personally think eventually we'll understand all the inflammatory diseases to be on some spectrum, and these are falling in that spectrum somewhere. But yeah, we're talking about less than 100, and you're hearing about every one of them. Whereas, Kawasaki is around 20,000 a year. So if we're talking 4 months in, we've had like 7,000 cases so far. I doubt you've heard a single time that CNN's mentioned it.
No, matter of fact, this year we haven't even heard about the flu. We don't even know where it went. So
it's disappeared.
It's disappeared off the face of the planet. All right. So we, in summary, and if I don't get the summary right, and then we'll close it out, you say, let me correct you.
Okay.
Reading your articles, listening, and you're using numbers that we're all seeing. You're just not putting the negative spin on it. Right. It's the glass half full, half empty thing. Just like I said on the air one day, because nobody said this, I said, you realize as of right now, 99% of you have nothing to worry about. 99%. I'll take those numbers all day long. Okay, but so COVID-19, in your medical opinion, okay, COVID-19 has been a flu season. It might have been something that we haven't seen specifically. We know about the conference. We just didn't know about this team, okay? But now watching this team, it appears that it's not any more, maybe even less, contagious than the influenzas that you've dealt with. It doesn't seem to be as serious as the influenzas you've dealt with. As we've all said, somebody says, I think I had the flu. What would we always say? Now, if you went to work or you went to school, you didn't have the flu.
That's right.
But with COVID-19, we have people that don't know they have it all the time. We actually know a friend of ours that has had a pretty severe case of it.
Had to go to the hospital.
He was a healthy guy, but he had a pretty severe case of it. Had to go to the hospital for a couple of days. Got back into his house. He was in his house with his family for 21 days. Not one member of the family got it. Okay. Yeah. All right, so and he's in the house with him. Now he's secluded into a room. In all fairness,
different floor.
But the way they're portraying this, if somebody's got it in your family, you got it, and that hasn't been the case. And then I'll go further. In your opinion, there's no need to have done this shutdown. There's no need to shut schools down, and there's no need to shut the sports industry down. These things appear not to be necessary and should have never been done.
Yeah. Well, like I said, I sent my first letters to Congress people arguing not to shut down as early as March the 20th. I said it out loud as early as March the 12th. The NBA shut down March the 11th. I was like, this just doesn't make sense. I mean, what in the world are we doing here? So I do think there's other factors behind it, but I just don't think you can argue. In a 6-month flu season, we get 1 billion cases, and it puts more people in the hospital globally than our total cases are 4.5 months into COVID. More people in the hospital than our total cases. And it kills roughly 300 to 650,000 people every single year, and we just don't hear about it. So there's a reason you're hearing about a virus that probably legitimately has killed somewhere just south of 100,000 people.
Yeah, even the Italy thing shocked me. You said basically these are Italy's numbers every year.
Mm-hmm.
Yeah. I guarantee you, 17-18 was larger. Ironically, and I'll just clarify, I did find 24,000 in several years before that. I couldn't, for whatever reason, find the exact number on 17-18, but I did find articles that said it was the worst they'd had. Everybody knows 17-18 in the medical community was a very bad flu season. 61,000 was the number in the United States. That's a lot of people to die and not hear a thing. So when one of the things I pointed out early to neighbors was, Fauci about early April said, okay, we're dropping our numbers down and there may be 100 to 200,000. I said, so, okay, what if we just give it 183,000? Well, that's 3 times as many as 61,000. All right, so take your flu coverage from 17-18 and multiply that by 3. Well, the flu coverage for 17-18 was about 0, so 0 times 3 is still 0. That would be the average medical attention you're going to get from the national media for these kind of numbers.
If you want to find out all these articles, read them for yourself. CoronavirusTruthAndLies.com. CoronavirusTruthAndLies.com. Dr. David Williams, thank you for being with us on this edition of Rick and Bubba University.
Thank you, Doctor.